Well, hey, Hannah.
Hey, Joe. How's it going?
I'm doing great. How are you doing?
I'm good. I'm honestly still recovering from all the fun that we had at the High Point Discovered launch party for our third magazine.
That was an incredible event.
It was really fun.
The Hall of Fame is such a beautiful space, and then you throw a couple hundred people in there.
Yeah.
And the visuals from the magazine, that was just incredible.
It was fun, and we had a really good turnout. A lot of people, and a lot of people who were able to see themselves in their stories. That's what I love, is people coming in and feeling that recognition of their story being told.
Yeah. Well, I mean, the way you framed that third magazine about kind of who we are as a city and listening to stories, I think is so relevant to what we're doing in the podcast, right? It's like,
absolutely,
what we're trying to do here is get people's stories out and help people to hear the passion and the energy behind people that are trying to solve problems in our city that are just kind of intractable problems. Like, they're really complicated, but there are people who devote their lives to them.
That's why I loved that, the brand personality traits that the city developed, like inspiring creatives, movement of makers, kind and inclusive. Those don't just work for people in creative fields.
Yeah.
They actually work for people who are in those, STEM and mental health and science and healthcare fields too, because you do have to be creative when you're solving problems like the ones that we're going to hear about today.
Yeah, no, I think when the Cognitive Foundation got involved with Family Services of the Piedmont, who we're talking about today and listening to, and got involved in the Child Wellness Center, one of the coolest things was going over to see the giant mural that they placed in the Child Wellness Center. And it's like this place where you see the artistic design creation parts of our city come together with mental health services, and saying these things are all connected, right? The way that our minds work, the way we as a community come together. As you said, creativity comes in a lot of different forms, and some of it is art and beauty, but some of it is also psychiatry and the incredible approaches that they're using with family services to provide those needed resources to our community.
Absolutely. Yeah. So without further ado, I'll let our listeners know that Family Services of the Piedmont is our guest today, and their mission statement is that Family Services of the Piedmont empowers individuals and families to restore hope, achieve stability, and thrive through quality support services, advocacy, and education. And they are...
They do a lot.
They do a lot. And I think that what's really unique about Family Services of the Piedmont is how they have been so intentional and creative to figure out ways to best serve the mental health needs of our young people and our kids. Yeah. I was so interested when we were listening to Dr. Jason Jones and Tracy Reeder talk about specifically child psychology is much closer to the way that we treat pediatrics than adult psychology. And so they've created this really unique model with the Child Wellness Center that serves specifically, I think it's 5 to 15-year-olds with those challenges, but also with that hope, with that advocacy, with that support to help them succeed.
Yeah, I mean, I think a lot of people... Family service does so much that sometimes like you hear about all the different pieces they're doing. For a lot of people, their association may be like Oyster Fest, right? Or the Oyster Roast, right? Yep. You go these big fundraisers, you learn about all the things this organization does. Today, we are really honing in on that Child Wellness Center because it is such a unique asset to our community. And I mean, one of my good friends is fostering on the long road to adoption. And her son has utilized this Child Wellness Center for years. And one of the things that she told me when I was asking her about her experiences with it is that she has taken her son to other facilities where it has felt like you're taking your kid into an institution. And she's like, one of the things that they loved about the Child Wellness Center is you walk in and it feels like an inviting space where like the kids want to go, and her son likes being there. And she said it's just an utterly different experience from other places that she's gone, and places that typically treat low-income families don't. Like, that's, I think, one of the things that is so incredible listening to Dr. Jones is that we have his level of expertise, the expertise of that staff in a kind of welcoming, home-like environment where people actually really want to come for that care that is so important, but also so hard to get. I mean, the waiting list to get in, the need in our community is huge.
Yep.
So we're blessed to have them, and I love this conversation. I'm really excited for you all to hear and learn from them, because I certainly learned a lot.
Same. So yeah, let's take a listen. Well, good morning. Thank you so much for joining us here on High Points Voices Discovered from Family Services of the Piedmont. We are super excited to have both of you on the show to help our community learn a little bit more about family services and what you all offer. It's an amazing thing, and I think that it's something that stretches, as we were chatting about, beyond just High Point. The reach is broad. So we can't wait to learn more. And we'll just start with some introductions. If you'll just both introduce yourself and your role with Family Services, we'll start there.
Case off, Tracy.
My name is Tracy Reeder. I'm a licensed clinical mental health counselor, and I provide outpatient therapy.
Excellent.
I'm Dr. Jason Jones. I'm a child and adolescent psychiatrist, and I am the medical director of Family Service of the Piedmont. Provide direct care and then oversight of our clinical services as well.
Wonderful.
Awesome. Give us just a big picture. A lot of people have heard of Family Services of the Piedmont, and some of the big services they provide. You all are part of a particular part of Family Services. Can you just map that out for people who are listening so they understand the big organization, and then kind of where we're really going to hone in is the part that you all are working with Family Services. Can you map that out a little bit for us?
So Family Service is a agency that provides help for children and families, victim services. We provide consumer credit counseling services. And then our particular division is counseling services. That is behavioral health counseling and psychiatry for children and adults.
Right. And you all are located here in High Point. Family Services, of course, serves across the county. But the Child Wellness Center that you all are working out of is located not far here from Congdon Yards.
Yeah.
Right.
Thanks for making the trip over to talk to us today. Can you say a little bit about what that counseling services, what the Child Wellness Center, what it does, and why it's important to our community?
We provide comprehensive clinical assessments, and then we determine what services would be needed going forward, whether that's counseling, psychiatry, case management, or a higher level of care.
And these are all pediatric, right?
Ages 5 to 15,
5 to
approximately.
15. Okay.
Yeah, so Family Service has 3 clinical sites, 2 in High Point and 1 in Greensboro.
Okay.
In 2016, I joined the organization as medical director, and Tom Campbell, our CEO, and I, over the years, developed a plan to open a child psychiatry center of excellence, a place that is exclusively dedicated to the treatment of children and adolescents who are dealing with behavioral health problems. Yeah. Most of these kinds of clinics that you may find in communities across the country intermingle adults with children, a lot of behavioral health clinics, particularly those that serve the population that we serve. And we thought this would be a novel place where we could design a child-friendly space that was exclusively dedicated to children and families.
Yeah. And when did you all get working on the Child Wellness Center?
So it started at a conversation in 2016 between Tom Campbell and I.
Okay.
And then we had to develop it, staff it, fund it, develop a budget. That came really into clear focus around 2018. And then our grand plans launched our clinic in March of 2020.
Okay. Wow.
An appropriate and important time to start such a clinic.
Yes.
Yeah.
Yes, it was quite a coincidence. It was a challenge to adapt to the new reality that the pandemic brought to all of us. At the time, we had very limited telehealth capacity, and so we had to rapidly adopt that. And so the idea of opening a new space and designing it and figuring out the workflows and the kinks in the middle of a pandemic was quite a challenge.
Yeah. Well, I mean, but thank goodness you all started back in 2016, working on that, because I think the kind of epidemic of child wellness coming out of the pandemic is so much more maybe talked about. Not that it didn't exist before the pandemic. It was certainly a major issue, but coming out of it, I think people are realizing the need that is there. And even with all that pre-planning, I know you all are swamped, right? I mean, the demand is just so incredibly high for the kinds of services that you provide.
It is. We designed the center before the pandemic, and our expectation was that we would see 500 children in our first year.
Yeah, how'd that go?
First year, I believe the number was close to 800 in our first year. And then subsequently, we are up to 2,000 at this point.
Yeah, because you all expanded, right?
Because we expanded. We expanded in 2022. That's right. Yes.
At an additional level, I know the foundation, Congdon Foundation, was part of that. The original idea and also the expansion, seeing that just the need. Yeah, I mean, it was amazing the foresight that the Congdon Foundation had in looking at our services before the pandemic. I mean, the rates of substance use problems and opioid overdose and suicide and other child mental health problems were all increasing prior to the pandemic. But the pandemic was an accelerant that added fuel to the fire. And it really was wonderful that we were in place for what was to become a child mental health crisis.
Yeah. Well, you mentioned that the center has been designed specifically to accommodate the needs of child mental health and wellness. And we talked a little bit before about some of those differentiators that sets Family Services, specifically the Child Wellness Center, apart. Can you both speak a little bit to what are some of those differentiators that are in place for the organization, and what makes that center, specifically able to meet the needs of children?
At our location, we have multiple child prescribers. We have Dr. Jones, we have a physician assistant, we have a nurse practitioner who are all specialized working with children. We have multiple therapists, either licensed clinical counselors like myself or licensed clinical social workers who provide counseling to children and their families. We provide group services to children and adolescents, and we also have a case manager on staff.
Wow. So that's like a full wraparound of all of these different things that are needed. And is that typical in a facility like that, or is that kind of an unusual model? Like you said, something kind of novel.
I think it's unique.
Yeah.
Yeah. It's unique. I mean, child psychiatry is not... Historically, child psychiatry has been thought of as a branch of adult psychiatry. But when you really think about it and you look at it and you consider the process and the experience of children and families coming through, it's actually closer to pediatrics than it is to adult psychiatry.
Really?
And so having a child center that is separate from adult psychiatry, who really we think about the lives of children as they are growing in their spaces, in their communities, in their cultures, in their families, and understanding that developmental perspective, having a safe, child-friendly space that is not intermingled with adults that may have different kinds of issues is really a unique setup. There are very few standalone child psychiatry centers, particularly ones that serve the public, and really we'll see anyone. We'll see anyone with any kind of insurance and coverage or no insurance coverage.
Well, so talk to me about that, because like you're going out and you're looking for therapy services, and a lot of therapists don't take insurance at all. You have to just pay cash, which is wildly prohibitive for a lot of families. Right. And then even if you're paying cash for a therapist, to see a child therapist, it's 6-9 months sometimes on a wait to get in. Like, talk to me a little bit about certainly the pay part. Like, how are you all making these services accessible? What kind of payments do you all take? Like, this is a complicated world. Can you make it simple for us?
We could certainly try.
Okay.
The insurance world is very complicated, and there is public insurance, Medicare and Medicaid, and then there's private insurance, and then a lot of varieties and combinations of things in between. One of the barriers to providing the kind of care that we want to provide is that insurance companies pay for very narrow delivery of services. They pay for the professional's time in front of the patient. In child psychiatry, when we have developmental problems and children that are growing, we really need to understand the full spectrum of their existence, of their behavior, of their families. And to do that, you need to be able to understand what's going on in the school. You need to be able to talk to collateral individuals who are involved in their lives, family members and others. And that's a lot of time spent.
And insurance doesn't pay for any of
Doesn't pay
that.
for any of that. It doesn't pay for the case
So if you want the face-to-face time that insurance
Yes.
actually pays for
Yes.
to be valuable, you have to spend all this other unpaid time
Exactly.
figuring out the whole
All the
context
pieces.
for the kid's life.
Exactly. Yeah. Case management, they might
And
call it.
that, hence that you said you all have a case manager, right? So like
Right.
that kind of broader view.
Right. A kind of a unique setup. We have in-house case management that is an unbillable service. We have specialized pediatric psychiatry nursing, which is unbillable. There is no revenue generated from that. But yet that, as we all know, nurses are the glue that hold together most medical clinics.
Yeah.
And having that level of professionalism and that level of comprehensive approach is really unique to our center.
Yeah. So, I mean, we could go down a rabbit hole of paying for medical care and all the issues with that. But it sounds like the short version of it is some of this stuff is reimbursable, but the vast majority of your costs are probably donated, right? Like you've got to get grants, you've got to get private philanthropy to help support it. Like these services obviously are not free. They're expensive services.
That's right.
And it takes a lot of grants and private philanthropy to make it happen.
It really does. It does in the sense that we want to provide the state-of-the-art, cutting-edge, high-quality service that someone who is paying cash might be able to obtain in their community.
Yeah.
We want to provide that for everyone.
Right.
And to be able to do that, you really need this comprehensive system. And, you can't bill your way into sustainability in a system like this. You have to get additional support from your community in order to make it work. So we're both dependent upon the community and invested in working with the community to help these children grow.
And that's, that kind of leads to a question of why, and this may seem obvious to you all in the world that you're in, but why is it important for communities as a whole to be invested in the mental wellness of their children? I mean, and not just their personal children, but the children in the neighborhoods and the world around them. I mean, what kind of outcomes does that have long term for an entire community, city, and county even?
So the statistics are that about half of all mental illness will begin prior to age 14. Adult mental illness.
Wow.
And so a large proportion of adult psychiatry problems, behavioral health problems, substance use disorders, depression, even schizophrenia, bipolar disorder, most of that will begin in childhood. The evidence also seems to indicate that early intervention has an impact that is lifelong. You can reduce the intensity and the severity of what is to become an adult psychiatric condition by intervening earlier in life. There's also a lot of evidence to connect the early childhood trauma to adult substance use. That is to say, adult substance use disorders are often correlated with untreated or undertreated childhood trauma. And so by recognizing childhood trauma, intervening and treating childhood trauma-related disorders in children, you actually could have a generational impact on decreasing the development of adult psychiatric problems and particularly substance use disorders in adults.
Wow. I mean, I think just prior to the pandemic, I became aware of ACEs and started incorporating that into some of the classes I was teaching at the university just to start raising awareness. But, what you're talking about is like, as you said, these generational impacts that we as a community, when people are thinking, why should I donate or why should I care about this thing when I don't have children anymore, my children have grown and gone, but you're talking about this affects an entire community, not just our healthcare costs, but the safety of our neighborhoods and schools and just the health of the people that
the productivity of our citizens.
Yeah,
the life expectancy of those citizens.
Yeah.
Yes. Yes, all of that. The life expectancy, the quality. There's also a ripple effect in behavioral health. That is to say, when a certain individual has a behavioral health condition, there is a contagion effect amongst others that are in their sort of proximal range, if you will. We know that suicide, for instance, can be contagious. And so media reports that talk a lot about suicide actually lead to more people contemplating suicide, for instance. Then the reverse is also true. When you have mental wellness and mental health and improvements, other people will see that, absorb that. It has a ripple effect of positivity through the community as well.
Yeah.
So you all are serving 2,000 something kids in a year. And you have a wait list, I'm sure it takes, I can't just call and get in tomorrow, right?
Luckily, a short wait list.
A short one. That's good. Well, so that's probably what I was going to ask is like, how much capacity do we need to serve our community? Like, how much more do we need to be doing to address the mental health challenges that you all are seeing? Are we adequately meeting them as a community, or is there still a big gap that's out there that we need to be thinking about how we address it?
I think that we are not fully aware of the depths and the severity of mental health challenges in youth in our communities. There's still a matter of stigma against mental health conditions. There is still a culture of not disclosing or not sharing when there are mental health concerns within a family. I think there is an openness, there is an increasing understanding and openness to the concept of behavioral health. We are seeing that stigma decrease. But we are seeing a flood of issues and needs that are well beyond the capacity of what we can provide to help. The demand far outstrips the supply of behavioral health services.
Well, you mentioned capacity, and I was thinking there's the capacity of just time in the day, but then there's also the capacity, I'm sure, from the clinician and therapist perspective of how much emotional capacity, how much mental capacity can you give to something like this that's such an emotionally draining crisis. So, what are some of those ways that there is that sense of maintained hope and maintained emotional capacity for therapists in an environment that could lead to a lot of compassion fatigue, burnout, and hopelessness, I'm imagining?
Self-care is very important. That's something I emphasize to families from session 1 is first I'm prioritizing sleep, hydration, nutrition, exercise, socializing, to just gauge where the child is, where the family is, how can I help promote these healthy habits, practicing the healthy habits, modeling the healthy habits for families so that we have a good foundation to start therapy.
And as medical director, I'm interested in doing all of those things for our staff as well.
Sure, yeah.
Staff self-care.
Well, I'm sure just finding and retaining therapists in this environment is challenging. Just like, many frontline workers, it's just hard to retain them, to keep them.
It is. It's a good and a bad thing, depending on one's perspective. There is an increased recognition of mental health problems. There is a lot of demand out there, which means that therapists can actually pick and choose a little bit about where they want to work. Because there are more need than there are therapists.
Yeah, absolutely.
Well, the challenges are no doubt huge. What brings you hope as you're facing them? Like, what can you give us some bright spots of like where you've seen this stuff work and changing lives? Because that's what we're doing, right? we're in this to change lives. Have you?
Yes.
Can you talk to us a little bit about what you've seen and how this works?
Seeing the progress, watching kids come in mopey, grumpy, I don't want to be here, and they feel themselves making progress, and they don't want to discharge. They enjoy coming to the office. They know that they're supported. We're seeing them make friends, have passing grades, getting along with their families, and then sometimes they are very sad to discharge when they don't get to come anymore because they've graduated.
That's got to be hard. Like you're there for the hardest part, and like when it's getting good, you've got to let them go.
But that's the victory for you, right? So
reward.
it's, that's the
the
moment that you
reward.
hope for, but also
yeah.
I'm sure is bittersweet. Yeah. How are some of those outcomes tracked? I mean, I'm sure that there is a lot of, data collection and follow-up outcome kind of things.
Dr. Jones has a lot of spreadsheets.
Yeah. some Excel, some serious Excel going on over there. But yeah, so how are some of those outcomes tracked? And I mean, what kind of changes have you seen in the mental health landscape just in the time that you've been in High Point?
Sure. So we have several layers of outcomes measures. We do consumer satisfaction surveys, of course. We measure symptom reduction with treatment. When folks come in, we have rating scales that assess the severity and the intensity of their symptoms, and then we track those over time. And then we have outcomes measures as well. There are different ways of thinking about how children are succeeding in school, social, family, environments, relationships, academics, and so we have these measures as well that look at those outcomes. So it is these individual successes that we celebrate and that give us hope. And then for me, it's also the intervention for intergenerational trauma and intergenerational transmission of mental health problems, to feel that I am part of a system and a process to address that, which is making significant changes in the life courses of families over generations. That gives me hope. Even if I have a difficult moment or day or week or month, knowing that in the biggest picture, we are moving things forward and we're moving folks towards more mental wellness is a real reinvigorating thing for us in our work.
I mean, I had a limited number of psychology classes in college, but what you're talking about, this kind of holistic approach and thinking about generations and thinking about community, that seems to kind of push against the grain of at least what I was kind of taught with psychology, that seemed to be so focused on the individual and the person and not fully understand the context. And I just keep hearing you talk about the context matters, and like if you can't just fix the one thing if they're put back into a context that continues to elicit the same trauma that you're trying to fix in the therapy sessions. Like as people are listening to this and they're thinking, how do they get involved, or do they know kids that need to be referred? Like how help our listeners with how they should be thinking about being engaged with you all, whether through referrals or just donations?
Both. Some of our staff recently had a meeting with Guilford County School District so we can inform the principals of our services. Some of the school counselors and school staff weren't aware of our agency or that they could make referrals to us. Yeah. We get referrals from pediatricians. Sometimes families who've been successful refer friends, neighbors to us. They pass along our information. So just word of mouth referrals.
Yeah.
You know, the concept of social determinants of health, that's a lot about the context that we're talking about here. We have sort of the individual's context of their biology, but then that biology exists within these social constructs and these social contexts. Social determinants of health include poverty, transportation issues, adult physical health issues, parents that are dealing with physical health or mental health problems. And so kind of anything that can help us to break down barriers to treatment, anything that could help break down stigma to treatment. And then also it's the funding of direct care programs. A lot of philanthropy and a lot of efforts to make inroads in these sectors are done on global levels, trying to think about global programming or global educating of the community. We also need people on the front lines providing the care directly to the families, and that's what's lacking. And so having more folks out there that are willing to support direct care programs would be a huge benefit to all of us.
Can you give us some examples of those direct care programs that you've seen make a real impact?
Our program, as through the vision of the Congdon Foundation and the Foundation for Healthy High Point and others, is this kind of direct care, where we are going directly into the lives of families and children, and we are trying to make an impact in their communities, in their schools, and in their homes. And so that's the kind of program I'm referring to.
Yeah, okay.
Tracy, for someone who perhaps may be listening and is, has never experienced any kind of mental health service or therapy, or maybe is even skeptical about, the kid's going in there and they're talking about something or they're doing something, can you just give,
They're just talking about their feelings.
Yeah, there's crying or something, could you share a little bit about high level, what kind of goes on in some of those sessions? What are some of those techniques that get employed to help specifically children identify some of those things while they're going through those developmental phases? They may not even have the language for some of that right now.
True. Play is the language of children. So our offices are well stocked with games, toys, drawing materials. So we'll engage children with a lot of hands-on activities to help them express their feelings, to help them engage, to help them feel comfortable. All of our clinicians are trained in MATCH, which stands for Modular Approach to Treating Children. We literally match interventions to sets of problems or specific problems such as anxiety, depression, trauma, conduct problems. And that also involves the caregivers. That might be a parent, a foster parent, a grandparent, but we need parent involvement so we can pass along the interventions for home use.
Okay, so that kind of does involve that, again, that contextual
Back to family
placement. Where it's like, okay, we can do as much as we can in my office, but then what happens at home is so important too.
Yeah, I see that. You're just talking about play. I was thinking, when my son has a rough day and we're like grilling him, like, what's going on? And he's just like, not going to talk. And then we go outside and we start throwing a football around or we'll start shooting baskets and I don't have to ask questions anymore.
Yeah.
Like he will just, because it's like he's in control. Like he's got.
And it's that space. I mean, I'm sure giving kids that safe space to we're not going to push you to answer all these hard questions right now. I'm sure it involves a lot of patience.
Yes.
Patience and trial and error sometimes. This game didn't work. Let's try this game.
Absolutely. This is also not a question that was on there, but I would love to hear both of you just share a little bit about what inspired you to pursue careers in mental health and wellness, and even from that clinical side.
Just wanting to help, seeing friends in distress as a kid, getting counseling myself as a teenager, speaking to coworkers of my mom. She was a nurse. She worked with social workers. She worked with psychologists, so I would spend time with them. So I took my first psychology class in high school and then just continued with that.
That's awesome.
I have always been drawn to complexity and ambiguity.
Well, you found it.
The brain. What could be more complex and yet ambiguous?
When I started medical school, I wanted to be an orthopedic surgeon. This could not be any more different than that. This is what fascinated me when I was in training was the difficult stuff, the unclear stuff. At the time also, and still today, that behavioral health is on the cutting edge of a lot of new developments in neuroimaging and different kinds of understandings of the way that the brain works. We are kind of in a golden era of that. And so it's fascinating to be there on the front lines of these discoveries and starting to understand these things better. We still don't know everything there is to know about the brain and about being a human being, but I am fascinated at the process of trying to understand that.
Yeah. I mean, it's like, as I age, there are just things that I'm learning about my body that I'm like, oh, I wish I would have known. Whenever I get stressed, that's when my low back hurts. And you start thinking about these connections between our bodies and our physical environment and our minds. And I don't know, so been taught that there's like this division between the mind and the body, and they're these two different things. And
yes.
We can treat one with one set of doctors and we treat one with the other set of doctors, and they don't ever have to talk. And you all are just looking at bodies and minds and communities a way that I don't think the traditional, certainly not the traditional insurance world and traditional medical training isn't looking at that stuff.
This is why, in my view, child psychiatry does need to involve psychiatrists and medical doctors, because we stand at the intersection of behavioral health and physical health conditions. And the mind-body connection is well established and understood at this point. There's a oneness there. We talked earlier about ACEs, adverse childhood experiences.
Yeah.
And those adverse childhood experiences run the gamut from the well-understood abuse to loss during childhood. Divorce, even moving.
Right.
Your family relocating in middle school is considered an adverse childhood experience. And adverse childhood experiences are associated with adult physical health concerns. Yeah. One of the ones that's most fascinating to me is if you have a certain number of adverse childhood experiences, your rate of cancer as an adult is doubled.
Yeah. And heart diseases go up, and I mean the whole list.
Yes.
I mean, the connections between those childhood experiences and adult outcomes are, I think, a lot more dramatic than at least most of us on the outside of the medical world would think of.
Right. So in addition to making, hopefully, generational change on the behavioral health and substance use side, we're also looking at decreasing adult medical problems by intervening in child mental health.
Yeah. So if people are listening to this and maybe they're Googling ACEs and they're going, oh, I have a number of those, which is not uncommon, right? An incredibly high number of Americans suffer from trauma in early childhood that plays out throughout our lives. And they're starting to think, maybe I need help. Maybe I should be talking to somebody. Or if we have people who are listening that are aware of kids that are in need, where do they go? What's the referral process? Who should they reach out to? How do they get in touch with you all?
First is usually the pediatrician, and the pediatrician does a variety of mood screeners nowadays that I didn't used to see. And then...
Yeah, I see that too. I see that most families are most comfortable. First of all, they want to try to handle it internally. That's the first thing.
Sure.
And then some may look to religious folks that they identify with that are important to them and maybe guides for them. I think then the pediatricians or primary care family doctors are often next. And there is a new model of embedding behavioral health clinicians in primary care pediatric practices. And so they can kind of do more sophisticated screenings and referrals. Other families are going to know, you know what, I know I need to go right to a behavioral health specialist. I need a child psychiatrist. And so, unfortunately, we often have to think about first, well, how are you going to pay for that? Are you going to use your insurance? Are you going to go outside of insurance? But we also at Family Service take direct referrals. If folks want to come just directly to us, they can access us through our intake line, and then they can get immediate treatment. We do not require a referral from a primary care provider. People can access us directly.
Well, we'll make sure we put that in the show notes too.
Definitely.
So people can access that information.
Yeah, absolutely.
Well, I think it's so important. I mean, just having you all on the podcast, having you all talk about this, removing more of that stigma that you all were talking about, that this is something that we need to be talking about. We want people to be aware. And one of the things I've long appreciated about Family Service of the Piedmont is the way it's so deeply connected with so many other resources. Like the Family Justice Center is one of the first places where I really started to see the impact that the Child Wellness Center and your work with children was having in our community, because certainly there are a lot of kids that are coming through our center here in High Point that need those services, and providing those services, coming on and talking about it on a podcast so people can be aware of it. I think there's just a lot for all of our listeners. There's a lot that all of us can do in our community to raise awareness, to support our kids. This is about all of our kids, not those kids over there or that kid, but they've all got to be our kids. And we've got to care about them because they are our community. So thank you all.
Thank you so much.
Wow. Well, I hope you all had a chance to soak some of that in, because I'm just learning a lot in this whole space. So vital to our community. So important what they're doing, and I'm just impressed and blessed that we have that resource here in High Point.
Absolutely. And I was talking to Dr. Jones after the fact, and they have already created so many great avenues for partnership through Family Services of the Piedmont, but that's growing so much more through the Child Wellness Center. Now they're going to actually be partnering with the Boys and Girls Club of Greater High Point, which future episode to
Yeah,
tease
that's right.
and
Teaser there.
to look forward to. But to be able to partner with organizations that already have these inroads with kids and youth,
Right.
and then to be able to stack on top of it this service that I think, as a society, we all are recognizing that need so much more. It seems, kind of obvious to say, but post-pandemic, everyone's realizing your mental health and your mental wellness is a huge component to thriving. Those social environments are a huge component to that thriving. So I think for them to have that service, to have experts like Dr. Jones and Tracy, and then to be able to plug into ready-made organizations that have those relational elements of trust, like the Boys and Girls Club, that's huge for High Point and for the county. That center attracts people from all over the county because of what they're offering.
Yeah. No, that's, you see the headlines like the kids are not all right. Like it is clear these mental health challenges are affecting youth all over the county, across income bands, and there's just not enough resources.
Right.
So yeah, I think they're highly sought after from, like you said, across the county. But I hope people will give. There's information in our show notes about how to do that. We've got to support this center. This is definitely a nonprofit that needs a lot of money to function, because these are, exceptional professionals that we have to keep in this center, right? And it's expensive to run this sort of project.
Absolutely. And I think that's a huge thing too, is you're not getting a second-rate service if you're coming to Family Services for these services. You are getting licensed mental health professionals with doctoral degrees who know so much about these experiences, funding that, keeping those professionals in High Point, meeting those needs. It's imperative.
Yeah.
I think it's also really important to say that if you or someone you know is looking for mental health services, Family Services of the Piedmont is a great first step. It's a resource that we can all use.
And you don't need a referral.
You don't need a referral. So we'll have those notes as well in the show notes. Definitely something to look into if someone you or is experiencing need for mental health services.
All right. Well, thank you all. It's been awesome listening again, learning again, hearing more stories, discovering more stories.
Absolutely. Thanks for being here. Thank you to Family Services for spending some time with us on the show. And thank you, as always, to our technical producers at Captivate Media. We will see you here in a couple weeks for another episode.